Hello and welcome to the Safe for Your Pleasure presentation for AEM AIDS Education Month presented by me, Kareem Mims, and
Me, Harlan Shaw.
so this is just a quick overview of some STIs and some safer sex information. Most people already know this information, but Harlan and I were just talking, and we noticed that we remember that people have been locked away for the last 3 months.
Yeah.
And we just want to like kind of just
Give you a refresher of sorts. Some of us may have forgotten how things work and what we need to look out for and to better protect ourselves.
right.
Sexually anyway.
So we got some slides here for you, and you can feel free to keep these slides, revisit them if you need to. But Harlan and I, we're just going to shoot from the hip. We're not going to read verbatim, but we'll make sure we touch on everything. So the first STI we're going to talk about today is chlamydia. Chlamydia can affect anyone who is sexually active, and if left untreated, it can cause a lot of long-term damage, right? And so while chlamydia can be treated and cured, some of the long-term damages often can't. And young people make up a lot of cases of chlamydia because maybe the lack of knowledge of testing, and also young people often don't have symptoms.
Yeah. Okay. So, like Kareem said, you could go for a while without having any symptoms of chlamydia. But if you do have symptoms, you might experience some of these, like an abnormal discharge coming from your penis or vaginal area. So that's like greenish, yellowish, pus type cloudy mixture that's coming out of your body.
Mm-hmm.
A burning sensation while you're urinating. So you go to the bathroom and it's painful. You might have something. You might want to see your doctor. Your rectal pains or a rectal discharge, and also rectal bleeding.
Right. So, sorry to cut you off. So, rectal chlamydia is kind of hard to spot, and also chlamydia in the throat is really hard, right? Because oftentimes you can't see those symptoms.
And
so
you might have strep throat, or you might just have or constipated or something like that.
Right. So if you don't, that's why it's really important, and we're going to talk about testing a little later. That if you notice something going on, you might want to see your doctor or go to your local clinic for routine testing. But we'll get into that a little later.
All right. So the next STI we're going to discuss is gonorrhea. It's chlamydia's evil sister. So gonorrhea is just like chlamydia. You can get it in all the same areas that you could get chlamydia. So that's your throat, your penis or vaginal area, and your rectum. Now, gonorrhea is also similar, untreated. You will have a lot of the same issues that you would have with chlamydia.
Right, and keep in mind that one doesn't cancel out the other, so you can have both at the same time, right? And so don't self-diagnose yourself if you notice any of the symptoms we talked about before. You want to just go to the doctor, get tested. You can contact myself or Harlan, and then we'll help take care of you.
And also, just to know, they're treated differently. They are both treated in the same category of medication, but the medication that you might get for either one is different. So make sure you talk to your healthcare provider.
So just like chlamydia, gonorrhea often presents no symptoms. But when you do have symptoms, like Harlan was saying, the symptoms are quite similar. Burning sensation, white or yellow discharge. Sometimes you'll get painful or swollen testicles if you have testicles, increased vaginal discharge, and vaginal bleeding outside of menstruation, right? So if you're not on your period and you're bleeding, doesn't always mean that it's gonorrhea, but it's something you want to, if you're sexually active, is you want to have your doctor take a look at you.
All right, so the third STI we're going to discuss tonight is syphilis. Now, syphilis has been around forever, since back in ancient times. There have been many people throughout history that have had syphilis and died of it. You wouldn't know unless you did the research. For you Pennsylvanians, the Milton Hershey and his wife both died from syphilis. That's why there were no heirs to the Hershey, like candy chocolate factory. Um, but there are multiple stages to syphilis, which is why it's also a very hard STI to notice that you have. Now, there's the primary, the secondary, and the latent stage, each having their own symptoms associated with those stages. And you can have syphilis for 10 years and not know you have it and pass it along to other partners.
So syphilis symptoms. Now, like Harlan said, syphilis is a very tricky one, right? Because most times people get syphilis on their private parts, but syphilis doesn't always appear on the private parts. And I noticed that while doing this work, that if it's not on your private parts, then people mostly overlook it, right?
Right.
The primary stage of syphilis, generally there's sores around the parts of your body you're using to have sex. So if you are having sex using the penis, then you'll have a sore that looks like a canker on your penis. Mm-hmm. If you're having sex with the vagina, then you'll have a canker in or around your vagina. If you're having anal sex, then you'll have a canker in or around your anus, right?
Right.
The secondary stage of syphilis.
Right. Yeah, the secondary stage is a little bit more tricky because you could easily mistake it for something else. Mm-hmm. So the secondary stage deals more with your skin. So you could have rashes appear on your palms of your hands and the bottom of your feet, which you could easily think is like an allergic reaction or something like that.
Poison ivy.
Poison ivy. There's one. Swollen lymph nodes. Now, your lymph nodes are like under your neck, under your arms, and on your groin. Those things swell up when you're sick. Mm-hmm. So that you could honestly think that you're just sick. And also having a fever that comes and goes, but is very like ongoing fever. Again, you could think you had the flu. So that's the second stage of syphilis, and
so the latent stages of syphilis come a lot later. So like Harlan was saying earlier, you can have syphilis for years and years and years and years. The symptoms may go away, but the syphilis actually doesn't go away, right? And so in the latent stages of syphilis, you will have no symptoms, and the syphilis can start to do some pretty damaging things to your body if left untreated, right? So,
like one of those things, you could lose your eyesight.
Mm-hmm, mm-hmm.
You could also, it deteriorates your brain, so you could start to hallucinate.
Right. So this is not a scare tactic; it's just a little bit of education.
Yeah.
Yeah.
Protect yourself. All right, so now we're done with the STIs and we're going to start talking about HIV. So HIV stands for Human Immunodeficiency Virus. Now, it is a virus that attacks your immune system. And what it does is that once you are infected with HIV, the virus will attach itself to your CD4 cells and then use those cells, mutate those cells to replicate itself and then create more of it so then it can attack more of your CD4 cells. And that process goes on and on and on.
And so gradually it weakens your immune system and it makes it harder to fight off like simple infections like the flu. If a person doesn't get treatment for HIV for long periods of time, there is something called opportunistic infections that can happen. And if a person has multiple opportunistic infections, then HIV turns into AIDS, right?
Which is an acquired immune deficiency syndrome.
So HIV symptoms. So this gets very tricky because HIV doesn't have its own set of symptoms. HIV symptoms can mirror something like the flu or a common cold, right? And since your immune system is being attacked, it may make it a little harder to fight off those symptoms or that infection, right? So flu-like symptoms include a sore throat, swollen glands, muscle ache, skin rash, nausea, vomiting or diarrhea, night sweats. If you're experiencing any of these symptoms and they don't typically go away in a certain amount of time, you might want to see your doctor, right? But again, doing this work, people used to come in to see me and they would say, I'm coughing, I have HIV. That's not the case all the time, right? If you feel like you've been exposed to HIV, the only way to really know is to get a test.
So that covers the brief and basic information about the STIs and HIV/AIDS. But now you need to know, how do you get them? So chlamydia, gonorrhea, syphilis can all be transmitted through oral, anal, or vaginal sex. If you have oral sex, anal, or vaginal sex without a condom, then with someone who has either chlamydia, gonorrhea, or syphilis, you can contract them. Now, HIV, on the other hand, you can only contract through vaginal or anal sex without a condom. Also, that's sexually. Let me backtrack. That's not 100% true. Now, you can also contract HIV through sharing needles, through breast milk, so that's a mother to her child, and basically any other exchange through bodily fluids except for saliva and urine. Hey, so I know we've been throwing a lot of information at you, and you're sitting there wondering, maybe I should go get tested. Who do I go to? Where do I go? So you can always go to many health centers in your local area. You can look them up through your local health department. You can also go to your doctor, that's your primary care provider, and ask for an STI and HIV test. Now, if you have symptoms, any of the symptoms we mentioned previously, you probably should go sooner than later. But if you want to make it just part of your common routines, you should definitely go get tested every 3 to 6 months. Now, if you have to, unfortunately, get test results back that you are positive with any of these STIs, so that's chlamydia, syphilis, and gonorrhea, you'll probably most likely get an antibiotic prescribed to you by your healthcare provider, and they will tell you to wait at least 7 to 10 days before re-engaging in sex.
It's also really important that after the 7 to 10 days to get retested just to make sure everything cleared up, right? Also, in my experience, a lot of people might have sex on the 6th day and then reinfect themselves and their partners, and then they have to start the process all over again.
Speaking of partners, it's also important to tell your partners to go get tested. If you have more than one sexual partner and you have a positive STI result, you need to tell them so that you don't get reinfected.
Right, right. And if telling your partner might not be safe or you just don't feel up to it, there are services that can, contact your partners for you. So you want to be honest with your doctor or whoever's treating your STI. And like Harlan was saying, if you're sexually active, you want to try to get tested routinely every 3 to 6 months. And in most cases for HIV testing, you'll get the results back the same day.
Don't have sex, because you will get pregnant and die. Don't have sex in the missionary position. Don't have sex standing up. Just don't do it. Promise? Okay, everybody take some rubbers. At your age, you're going to be having a lot of urges. You're going to want to take off your clothes and touch each other. But if you do touch each other, you will get chlamydia and die. Don't have sex.
So if you don't know, that's a famous clip from a famous movie from Harlan and my youth called Mean Girls. And so what's interesting about that is because when we were growing up, that's how we were taught about that was our sexual education. It was like, don't have sex or you're going to die, right? So Harlan and I, we don't believe that. Sex is fun. And if you want to have sex, you should have sex, but we want you to have the tools to know how to take care of yourself in case something happens, right?
So don't let this clip or any myths or rumors you've heard about sex that scare you about it. It's something natural that you need to explore for yourself,
Right.
but do it safely.
And
Use
even
condoms.
right. And even if you don't like using condoms, there's other safe ways to engage in sex, right?
Which
You
we'll
can engage in activity that don't require you to swap fluids with somebody, like masturbation, playing with yourself, mutual masturbation, playing with a friend, right? Kissing, cuddling. None of these things transmit HIV or STIs, right? And even if you don't want to have sex, that's also okay.
Let's talk about PrEP. PrEP stands for pre-exposed prophylactic. It is a one-a-day pill that you would take to prevent you from contracting HIV. Now, you can, many ways you can get PrEP. You can get it from your doctor. You can get it through a healthcare professional or a clinic. What you can't do is just take one of your friends' PrEP and just start doing it on your own. No, there's a process. And most times that process will begin with getting tested. Correct?
So the main requirement to get on PrEP is that you have to have an HIV negative test, right? So oftentimes you go into like a health clinic, or if you come to Philadelphia Fight and say you want to see me for an HIV test, I'll talk to you if your test is negative about PrEP and if PrEP it will be right for you, right? Um,
And then what he will do is make a referral, and you would come see me. And
mhm.
when you walk into my office, what you will do, we'll sit here, we'll talk about your sexual history. What do you think your risks are? How do you want to change them? Like, what changes do you think you need to make in your life? And then we'll go over the info for PrEP, like side effects, and how often you need to take it, when you're going to take it, and any other adherence and retention like assistance I could provide. Now, if you don't have insurance, let's not let that be a barrier. You should. We can also make sure you can get it for free, 100% free. There are different programs that we have available to you that we can sign you up for. Now, if you're not taking PrEP already and you happen to have sex recently with someone or in the future and unprotected and you
Condomless.
condomless and you are afraid that you may have contracted something or you don't know their status because you didn't have that very vital conversation about your sexual past, um, you can go see a healthcare provider within 72 hours of that sexual encounter and get PEP, which is post-exposure prophylactic. Now, with PEP, you will be given the same medication that you would be given for PrEP, which would be Truvada, um, and another pill. You would take both pills for 28 days after seeing your medical professional, and then come back after the 28 days for testing, just to make sure that the medication works. And what it's supposed to do is, in that time frame, if taken every day, prevent you from acquiring any HIV.
So, uh, this is the end of our presentation.
Yeah, hope you
Um,
liked it.
we're not used to this style of presenting, but given the state of the world, like this is what we got.
Yeah.
So, if you have any questions or need other resources about any kind of STI services, HIV services, or anything,
Anything. If you just want to come talk to us, pick our brains some more about anything that we discussed here during this presentation,
you can email us at the Kareem KMIMS at fight.org or
hshaw@fight.org.
for other HIV and STI resources, you can go to cdc.gov, healthpa.gov, or visit the Philadelphia Fight website.
Right.
We hope everyone is staying home and being safe.
Wear your mask, use your hand sanitizer, wash your hands.
And hopefully we'll see you all soon.
Bye, guys.
Bye.